Hello friends, welcome to the Fundamental Pharmacy. My dear students, I hope everyone is fine and safe. Let's start today's video. In today's video, we are going to discuss 2-3 points only. Various branches of pharmacy and their fathers, because most of the time they used to ask the question from this topic. Last year 2019 May there was a question about father of pharmacology, so I thought I would cover in one table, so that is important. In next table we are going to discuss about the some important terminologies of pharmacology. Pharmacology में थोड़े से important terms है, उसके बारे में discuss करेंगे. And lastly, last one एक table है, lastly we will discuss about the disease and their drug of choice. Okay, disease and their drug of choice. So let's start today's video. First, that is various branches of pharmacy and their fathers. So इसमें जो भी important start. So first one is father of biology, zoology and embryology. You must know about the father of who is the father of biology, embryology and zoology. So Aristotle is the father of biology, embryology and zoology. Then next one is who is the father of microscopy. So Anton van Leeuwenhoek. Antony van Leeuwenhoek is the father of microscopy. Okay, so he has developed the microscope, compound microscope. So that's why he is known as father of microscopy, Antony van Leeuwenhoek. Okay, so next one is father of bacteriology. We are not going to take all fathers, but we are going to discuss only whatever is important for GPAT, Niper, drug inspector and pharmacist exam. So next one is father of bacteriology. So Robert Cook is known as father of bacteriology. Okay, so Stanley is known as father of virology. Micheli is known as father of mycology. Mycology is nothing but the study of fungi. Okay, so science of fungi. So mycology, father of mycology is Micheli. So you must remember this. Then father of parasitology is Bladder. Then father of immunology it is important, father of immunology. So Edward Jenner is the known as father of immunology, physiology. So Aristotle is known as father of physiology. So next one is Hippocrates. You must be aware about this. Hippocrates is known as father of medicine or father of western medicine. सबको मालूम है कि हिप्पोक्रेट इज नोन एज फादर ऑफ मेडिसिन एंड फादर ऑफ मॉडर्न मेडिसिन और फादर ऑफ वेस्टर्न मेडिसिन. ठीक है, ये सब आप लोगों को पता है, लेकिन एक बार रिवीजन करने में क्या दिक्कत है बॉस, आपको कुछ ना कुछ फायदा ही होगा, लॉस तो नहीं होगा. तो इसलिए आई वुड लाइक टू रिक्वेस्ट टू वॉच दिस वीडियो अप टू द एंड. ठीक है, 10 मिनट में आपको इतना सारा रिवाइज हो जाएगा, तो इसमें कुछ आपको क्या घाटा थोड़ी है, तो सुनने में क्या दिक्कत है बॉस, इट्स फ्री ऑफ कॉस्ट. ठीक है, सो नेक्स्ट वन इज फादर ऑफ बायोकेमिस्ट्री. हु इज नोन एज फादर ऑफ बायोकेमिस्ट्री? कार्ल अलेक्जेंडर न्यूबर्ग. कार्ल अलेक्जेंडर न्यूबर्ग is known as father of your biochemistry. Okay, so you must remember this father of biochemistry. Then next one is father of endocrinology. Father of endocrinology is known as Addison. Father of endocrinology is Addison. Then Carl Landsteiner. Carl Landsteiner is the father of transfusion medicine and blood groups. Okay, Carl Landsteiner is the father of transfusion medicine and blood group. Transfusion medicine means every medicine that is given by intravenous route, that is known as transfusion medicine. And the father of transfusion medicine is Carl Landsteiner. It is also known as father of blood groups. Okay, you must remember these terms. Moving on the next one is father of Indian surgery. So सुश्रुता, चरक सुश्रुत समीता. अपने पास एक है चरक सुश्रुत समीक्षा, चरक सुश्रुत समीक्षा. सो इंडियन सर्जरी के फादर है सुश्रुत. ओके, सो फादर ऑफ इंडियन सर्जरी इज सुश्रुता. ओके, then next important branch of pharmacy is pharmacology, and father of pharmacology is Oswald Schmideberg. Oswald Schmideberg. you must remember this father of pharmacology is Oswald Shimejawar. Then father of Indian pharmacology, Ramnath Chopra is the father of Indian pharmacology. Okay, Ramnath Chopra is the father of Indian pharmacology. You must remember. Then next one is father of chemotherapy. This is important. Father of chemotherapy, that is, who is the father of chemotherapy? Paul Ehrlich. Okay. Then father of antibiotics, that is known as Alexander Fleming. Alexander Fleming is known as father of antibiotics. Okay. Then next one is father of microbiology. So Louis Pasteur. Louis Pasteur is known as father of microbiology. Okay. Remember this, Louis Pasteur is known as father of microbiology. That pasteurization of milk, that is heating up milk at 78 degrees Celsius successive for 3 days, that is known as pasteurization technique, and that was invented by Louis Pasteur. Okay, so Louis Pasteur is known as father of microbiology. Then father of pharmacognosy. Father of pharmacognosy, Sidler. C.A. Sidler is known as father of pharmacognosy, and I think this was the question in GPAT 2019. So you must remember this father of pharmacognosy. C.A. Sidler is known as father of pharmacognosy. Okay, so these are the some branches of pharmacy and their respective fathers. So this is important because they might ask the questions from this, and they have already asked one questions in 2019. Different types of different branches of pharmacy and their fathers. Okay, so next important table we have here some important definitions. Okay, some important definitions from pharmacology. So first one is lethal dose. What do you mean by lethal dose? What do you mean by toxic dose? So lethal dose is nothing but the amount of medicine or amount of drug that could kill a person. Okay, that could kill a person, that is known as lethal dose. And what is meant by toxic dose? Amount of medicine or drug that can cause or that can show signs and symptoms of drug toxicity. Okay, and toxic dose, every toxic dose is not every time a lethal dose. Okay, आपको ये समझना होगा कि व्हाट इज द डिफरेंस बिटवीन लीथल डोज एंड टॉक्सिक डोज. कि टॉक्सिक डोज हर समय पे लीथल नहीं होता. ओके, लेकिन लीथल डोज टॉक्सिक हो ही सकता है ऑब्वियसली. ठीक है, तो टॉक्सिक डोज मीन्स आपको सिर्फ टॉक्सिसिटी के सिम्टम्स नजर आएंगे एट अ डोज विच गिव symptoms of toxicity, that is known as toxic dose. And the dose at which the dose of medicine that can kill a person, that is known as lethal dose. Okay, then initial dose, divided dose, unit dose, cumulative dose, that is not important. Okay, so moving on the next. So next important point, that is loading dose and maintenance dose. So you must be aware about what is loading dose, what is maintenance dose. So we will discuss about what is loading dose. Loading dose is the initial large dose that may be given to deliver the drug to a therapeutic level in the body more rapidly. Okay, so basically loading dose क्या होता है? It is a maximum dose or it is a large dose that is given to a patient initially to get therapeutic level rapidly. Okay, आपको थेरेपेटिक लेवल को रीच करना है और रैपिडली रीच करना है. सो दैट इज द डोज, लार्जर डोज, दैट इज नोन एज लोडिंग डोज. ओके, और देन व्हाट इज मेंटेनेंस डोज? अमाउंट ऑफ दैट ड्रग विच विल कीप द कॉन्सेंट्रेशन ऑफ ड्रग एट थेरेपेटिक लेवल. उसको मेंटेन करना है आपको. एक बार लोडिंग डोज दिया, आपको थेरेपेटिक लेवल आ गई, लेवल ऑफ ड्रग आ गई, थेरेपेटिक लेवल ऑफ ड्रग, तो उसको मेंटेन करना है आपको. सो दैट मैक्सिमम इफेक्ट विल बी देयर, वट एवर इज द फार्माकोलॉजिकल इफेक्ट ऑफ ड्रग that you have to maintain. So for that you have to give maintenance dose. Okay, so amount of drug that will keep concentration of drug in the therapeutic level, that is known as maintenance dose. So always loading dose is given first, then maintenance dose is given. Okay, then you must be aware about what is minimum dose, what is maximum dose. I don't think it is required to tell you what is minimum dose, what is maximum dose. And if it is required for you, then GPAT is not for you. You are not made for GPAT, remember. So next term is apnea. What do you mean by apnea? So बहुत सारे लोगों को पता नहीं होता कि apnea होता क्या है एक्चुअली. वो एपनिया तो लिख देते साइड इफेक्ट या फिर यूज में किसी ड्रग के यूज में लिख देते इट इज यूज्ड इन एपनिया, बट दे डोंट नो व्हाट इज मीन बाय एपनिया. सो इट इज अ टेम्पररी cessation of breathing, especially during the sleep. Temporary cessation of breathing means temporary stopping of breathing. Okay, उसका breathing stop होता है temporarily. That is known as apnea. Apnea means absence of breathing. Okay, dyspnea means next term is dyspnea. Dyspnea means lowering of breathing rate or difficulty in breathing. Difficulty in breathing or lowering of breathing rate is known as dyspnea. Next term is anorexia. Anorexia means loss of appetite. आपको भूख नहीं लग रही, किसी मेडिसिन की वजह से आपको भूख नहीं लग रही, that is known as anorexia. Okay, next term is dementia. What do you mean by dementia? Dementia is nothing but the loss of intellectual ability involving the impairment of memory and judgment. Okay, so dementia मीन्स उसको एक टर्म है हिंदी में, जिस जो भी ह्यूमन से 60 या 60 प्लस एज जिनका होता है उनको एक बोलते हैं कि सटिया गया मतलब उसको कुछ समझ में नहीं आता, उसको इंटेलेक्चुअल एबिलिटी कम होती है. तो जिसका भी जिस भी बूढ़े माँ जो भी बूढ़े होते हैं मोर देन 60 प्लस, तो उनको ये प्रॉब्लम होती है डिमेंशिया की. ओके, लॉस ऑफ इंटेलेक्चुअल एबिलिटी इन्वॉल्विंग द इम्पेयरमेंट ऑफ मेमोरी एंड जजमेंट. एंड you will get these terms dementia in case of Parkinson disease. Dementia होता है उसमें loss of intellectual ability, so it is known as dementia. Okay, dementia. Next term is erythema. Erythema means redness of skin due to congestion of the capillaries. ठीक है, इसमें क्या होता है, जो आपका स्किन जो है रेडनेस होता है उसको बोलता है इरेथमा. इसमें आपको हिस्टामाइन रिसेप्टर ब्लॉकर्स ड्रग जो होते हैं, जैसे कि आपका फिनिलेफ्रिन हो गया, सेट्रेजिन हो गया, दोज आर यूज्ड इन इरेथमा. ओके, नेक्स्ट टर्म इज एनुरिया. एनुरिया मीन्स नो यूरिन, देयर इज अ नो यूरिन, दैट इज नोन एज और कंप्लीट सेपरेशन ऑफ यूरिन फॉर्मेशन इन द किडनी, दैट इज नोन एज एनुरिया. ओके, पॉलीयूरिया मीन्स formation of more urine than normal. Formation of more urine than normal, that is polyuria. Okay, so next term is alopecia. Alopecia means absence of hair on your head, that is known as baldness. Okay, alopecia, टक्करापन जिसको बोलते हैं उसको बोलते हैं एलोपेशिया. ठीक है, इसमें एक ड्रग यूज करते हैं मिनोक्सिडिल. मस्त आपको रिमेम्बर होना चाहिए कि एलोपेशिया में मिनोक्सिडिल एक ड्रग है, वो यूज करते हैं, दैट इज पोटेशियम चैनल ओपनर. ओके, सो मिनोक्सिडिल इज अ ड्रग यूज्ड इन एलोपेशिया. सो नेक्स्ट टर्म इज ataxia. What do you mean by ataxia? Loss of full control of body movements and coordination. Okay, this is a condition in which there is a impairment of balancing and coordination of the patient. Okay, that is and patient is not able to control himself. वो बैलेंस नहीं कर पाता खुद की बॉडी को और उसके मूवमेंट स्मूथ नहीं होते, थोड़ा सा अंडरशूट एंड ओवरशूट होता है उसमें. सो इट इज नोन एज एटेक्सिया. एटेक्सिया के 10-12 टाइप होते हैं, सेरेब्रल एटेक्सिया, पेड्रिक्स एटेक्सिया, स्पाइनोसेरेब्रल एटेक्सिया, बहुत सारा होता है. ओके, एटेक्सिया इट इज अ एडवर्स इफेक्ट ऑफ एंटी एपिलेप्टिक ड्रग. रिमेंबर, इट इज वन ऑफ द एडवर्स इफेक्ट ऑफ एंटी एपिलेप्टिक ड्रग्स. ओके, देन एटेक्सिया क्यों होता है, किसी को ब्रेन हेमरेज हो गया या फिर कोई इन्फेक्शन हो गया या फिर एटेक्सिया जेनेटिक भी होता है. तो ये डिफरेंट टाइप के होते हैं एटेक्सिया. ये मैं आपको इसलिए बोलता हूँ एटेक्सिया के बारे में इतना कुछ बोला है क्योंकि मोस्ट ऑफ द स्टूडेंट डज नॉट नो दैट योर जीपैट गाइड इज सफरिंग फ्रॉम एटेक्सिया. ओके, so most of the students does not know that I am suffering from this ataxia problem. So moving on, next, what is mean by feminization? Next term is feminization. Feminization means development of female characters in the male because of hormonal imbalance or hormonal disorders, that is known as feminization. आपको मालूम ये होगा कि अदर टर्म्स हिंदी में क्या बोलते हैं उसको, बहुत सारे लोग मजाक करते हैं उसके. तो डेवलपमेंट ऑफ फीमेल कैरेक्टर्स इन द मेल बिकॉज ऑफ हार्मोनल डिसऑर्डर, दैट इज नोन एज फेमिनाइजेशन. ओके, सो नेक्स्ट टर्म इज हिर्सुटिज्म. नेक्स्ट टर्म इज हिर्सुटिज्म. व्हाट डू यू मीन बाय हिर्सुटिज्म? Hirsutism is nothing but the abnormal growth of hairs on woman's body or face. अगर किसी लेडीज में दाढ़ी पे बाल आते हैं या फिर मूंछ आती है लेडीज को, दैट इज वी विल कॉल इट एज हिर्सुटिज्म, एबनॉर्मल ग्रोथ ऑफ हेयर ऑन द वुमन्स फेस एंड बॉडी. ठीक है, नॉर्मली लेडीज में वो बाल नहीं होते, अगर वो दिख गए तो दैट इज नोन एज हिर्सुटिज्म. ओके, देन व्हाट इज मीन बाय नेक्स्ट टर्म इज एमनोरिया. अमेनोरिया, एमनोरिया और अमेनोरिया, it is nothing but the absence of menstrual cycle in the ladies. If there is absence of menstrual cycle in the ladies, that is known as amenorrhea. Then next term is dysmenorrhea. Dysmenorrhea is nothing but the painful menstruation, and in that case there may be abdominal cramps. Okay, there is a menstrual cycle, but that menstrual cycle is painful and it involves the abdominal cramps. And dysmenorrhea में most of the non-steroidal anti-inflammatory drugs are used in dysmenorrhea. जैसे कि आपका जो आपका जो मेपेनेमिक एसिड हो गया, या फिर आपका जो एसिक्लोपेनाक हो गया, एसिक्लोपेनाक डाइक्लोपेनाक आर नॉट यूज्ड इन dysmenorrhea मोस्टली. नेपोमेटन हो गया, या फिर आपका आइबुप्रोफेन हो गया, वो डिस्मेनोरिया में यूज करते हैं. उसमें और एक डाइसाइक्लोमाइन बोल के एक एट्रोपिन का एक एनालॉग है, दैट स्मूथ मसल रिलैक्सेंट है वो, दैट इज आल्सो यूज्ड टू रिलीव द एब्डोमिनल क्रैम्प्स. ओके, साइक्लोबाम नाम का एक टैबलेट आता है, और मेप्टल पास नाम का एक टैबलेट आता है. मेफेनेमिक एसिड एंड पैरास्टामोल का कॉम्बिनेशन आता है मेप्टल पास में, और साइक्लोबाम में आता है डाइसाइक्लोमाइन प्लस पैरास्टामोल. दैट इज बोथ आर यूज्ड टू रिलीव द एब्डोमिनल क्रैम्प्स. ओके, so these are the some few important terms from pharmacology. So in the next table we are going to discuss about the different drug of choice and different condition and their drug of choice. Okay, तो it is important, ये आपके लिए important है tables. इसको जैसे मैं बोलता हूँ वैसे आप याद रखिए. आपको इसमें जीपैट में इसका बेनिफिट मिलेगा, नाइपर में बेनिफिट मिलेगा आपको मोस्टली, और ड्रग इंस्पेक्टर में और फार्मासिस्ट गवर्नमेंट का जो एग्जाम होता है उसमें आपको बेनिफिट मिलेगा. तो चलो इसको देख लेते हैं. सो लेट्स सी. सो फर्स्ट condition is paracetamol poisoning. Okay, paracetamol poisoning it may occurs due to the ingestion of larger doses of paracetamol. More than 5 gram per day will be a lethal dose, or will be a toxic dose. Sorry, not lethal dose, it will be a toxic dose of paracetamol more than 5 gram per day. So in that case you have to use N-acetylcysteine, which is a specific antidote and drug of choice for the paracetamol poisoning. Okay, N-acetylcysteine, remember this, N-acetylcysteine. And also there is another drug, methionine. Okay, both are sulfur containing amino acid, those are used as a drug of choice in paracetamol poisoning. Okay, or antidote of paracetamol. Okay, so next condition is atropine poisoning. So you must be aware about that. Atropine is a muscarinic blocker and it is used in various conditions, and it is a emergency drug. Actually atropine is a emergency drug. Various type of poisoning we have to use atropine for the to control the secretion of patient while during the treatment of poisoning. So atropine is used, and sometimes there is atropine poisoning. So physostigmine is the antidote for atropine poisoning. Atropine is a muscarinic blocker, physostigmine is a muscarinic agonist. Okay, so that's why physostigmine is used. Then drug of choice in acute bronchial asthma is salbutamol. Okay, in case of acute bronchial asthma you have to use salbutamol, that is a drug of choice. Okay, so you must recall here what is salbutamol actually and what is the mechanism of salbutamol. You have to study in this manner. If you study in this manner you can easily qualify whatever you want. You can qualify GPAT, Niper, drug inspector, pharmacist, because you have to read. You must develop interest in learning. आपको जो भी पढ़ रहे हैं उसमें इंटरेस्ट दिखाओ, आप इंटरेस्ट डेवलप करो. जो भी पढ़ रहे हैं उसके बारे में और पढ़ने का कोशिश करो. आपको इजीली हो जाएगा। ऐसा नहीं कि मैंने एक टेबल दिया वो टेबल ही पढ़ना है, इसको तो फिर वो रट्टा मारना बोलते हैं उसको। तो रट्टा मत मारो, थोड़ा सा बेसिक आपका नॉलेज बढ़ाओ। अगर आपके पास नॉलेज है तो आपको कहाँ पे भी चांस मिलेगा, आपको चांस भी आप डेवलप कर सकते हैं उसमें। ठीक है, तो नेक्स्ट ड्रग इज साइनाइड पॉइजनिंग। इन केस ऑफ साइनाइड पॉइजनिंग, amyl nitrate is a drug of choice. Okay, you must remember drug of choice in cyanide poisoning is amyl nitrate. So amyl nitrate क्या करेगा, जो मिथाइल हीमोग्लोबिन जो बनता है उसमें, तो वो मिथाइल साइनाइड हीमोग्लोबिन जिसका कॉम्प्लेक्स बनता है, मिथाइल साइनाइड हीमोग्लोबिन का कॉम्प्लेक्स बनता है उसमें, तो उसमें वो बनने नहीं देता अमाइल नाइट्रेट, खुद कॉम्प्लेक्स बनाता है और दैट विल बी इजीली डिटैच्ड। ठीक है, तो अमाइल नाइट्रेट उसके साथ कॉम्प्लेक्स फॉर्म करता है और एंड प्रिवेंट करता है हीमोलाइसिस, जो ब्रेकडाउन ऑफ आरबीसी है उसको प्रिवेंट करता है। तो अमाइल नाइट्रेट इज यूज्ड इन द साइनाइड पॉइजनिंग। एंड नॉन स्टेरॉइडल एंटी इन्फ्लेमेटरी ड्रग्स, non-steroidal anti-inflammatory drugs are drug of choice in case of acute gout attack. ठीक है, gout means there is deposition of uric acid crystal on the synovial joints, particularly the knee, and that leads to the inflammation and swelling, pain, etc. So in that case, non-steroidal anti-inflammatory drugs like aceclofenac, diclofenac, ibuprofen, nebumetone, celecoxib, repocoxib, phenylbutazone, these are the examples. They are the drug of choice in acute gout. Okay, so next one is your benzodiazepine poisoning. So benzodiazepines are steady hypnotic drug, and if there is poisoning, you have to use drug of choice, or it is a specific antidote also. Flumazenil is a antagonist, it is a specific antagonist of benzodiazepines. Okay, so जो भी benzodiazepine का receptor होता है, that is known as GABA A1, that is also known as omega receptors. So it is a specific antagonist of that benzodiazepine. So flumazenil is a drug of choice in benzodiazepine poisoning, or flumazenil is a antidote for benzodiazepine poisoning. Okay, then calcium gluconate is drug of choice in acute hyperkalemia. ठीक है, so next one is tetracycline. So in case of cholera, drug of choice of tetracycline. कॉलरा की कंडीशन में होता है टेट्रासाइक्लिन ड्रग ऑफ चॉइस. सो टेट्रासाइक्लिन्स आर ड्रग ऑफ चॉइस इन केस ऑफ कॉलरा. जो कॉलरा का पेंडेमिक आया था, इट वाज अनस्टॉपेबल एंड एट द टाइम टेट्रासाइक्लिन वाज यूज्ड effectively to control the cholera. Okay, so next one is digitalis toxicity. The condition is digitalis toxicity. If there is a toxicity of digitalis, so there is a one specific antidote for digitalis, that is known as digibind. Okay, digibind is the specific antidote or drug of choice in case of digitalis toxicity. Remember this. In case of kala azar, there is amphotericin B. Amphotericin B in the liposomal dosage form, amphotericin B is used as a drug of choice in case of kala azar. Then in case of acute migraine, sumatriptan is drug of choice. In case of acute migraine, sumatriptan is a drug of choice. This was the question already asked. Then paracetamol poisoning का भी क्वेश्चन आ चुका है. साइनाइड पॉइजनिंग का क्वेश्चन आ चुका है. आपका बेंजोडाइजेपिन का पॉइजनिंग का क्वेश्चन आ चुका है. सो इट इज इंपॉर्टेंट, दिस टेबल इज वेरी इंपॉर्टेंट. नेक्स्ट कंडीशन इज आयरन पॉइजनिंग. इन केस ऑफ आयरन पॉइजनिंग, यू हैव डिफेरोक्सामाइन. इफ यू हैव डिफेरोक्सामाइन drug as a drug of choice, डिफेरोक्सामाइन is used as a drug of choice in iron poisoning. Okay, then next is vancomycin. Vancomycin is used as a drug of choice in case of MRSA. MRSA means methicillin resistant staphylococcus aureus infections. So methicillin resistant staphylococcus aureus infections. So ये स्टेफिलोकोकस aureus जो होता है बैक्टीरिया, that is resistant to penicillins, cephalosporins and most of the all that sulfonamides, quinone antibiotics. So In that case you have to use vancomycin. That is a drug of choice. So linezolid, next one is linezolid. Linezolid is a drug of choice in VRSA. VRSA means vancomycin resistant staphylococcus aureus. So staphylococcus aureus was the bacteria who have developed resistance to many antibiotics. Most of the antibiotics are ineffective in the staphylococcus aureus infection, so vancomycin was used. Okay, but some staphylococcus aureus strains also developed resistance to the vancomycin. In that case you have to use linezolid. Okay, next one is alcohol poisoning. In case of alcohol poisoning, drug of choice is fomepizole. Okay, fomepizole is a drug of choice in case of alcohol poisoning. Then pentolamine is used as a drug of choice in case of cheese reaction. Remember this, pentolamine is used as a drug of choice in case of that cheese reaction. Then specific antidote for warfarin poisoning is vitamin K. Okay, then fluoxetine is selective serotonin reuptake inhibitor. You must remember it is an antidepressant and it is a drug of choice in case of obsessive compulsive disorders. Okay, fluoxetine is used. Fluoxetine is a drug of choice. And in case of drug of choice in case of epilepsy in pregnancy, phenobarbital. Okay, remember phenobarbital is a drug of choice. And what is the drug of choice for anaphylactic shocks? Adrenaline is a drug of choice in anaphylactic shock, and isoprenaline is preferred over adrenaline in case of cardiogenic shock. So you must remember. So this was the few condition and their drug of choice. Okay, so if you want these type of notes you can contact me directly. सबको मालूम ही होगा कि मैं हूँ कौन, मेरा नंबर क्या है, मेरा क्या है, सबको मालूम है. ठीक है, तो anybody if needs such kind of notes he can contact me directly. Okay, so if anybody wants these kind of notes he or she can contact me directly. My WhatsApp number is 9766654377. Everybody knows that. And we have different kind of groups, WhatsApp groups, free WhatsApp groups as well as paid WhatsApp groups for preparation of GPAT Niper Drug Inspector Pharmacist. We also have our website, we also have our application, and where GPAT Master application is there, Android application, where we used to have free GPAT test series and free Niper test series. We also have a separate group for girls, and we have recently published 2 books for GPAT. First one is MCQs in GPAT Niper DI Pharmacist, which is popularly known as GPAT Cracker and Achiever, and everybody is aware about that. So most of the question they are asking from this book. Okay, and recently we also have published this Fundamentals of GPAT Niper DI Pharmacist for chapter wise notes and chapter wise MCQs. This book will be available in this month after 20th June. Okay, so if you want this you can order from me directly, or you can order from Amazon Flipkart. It will be made available on Amazon Flipkart soon. It is not there now, but it will be available over there after 20th June. Okay, so if you want to order you can contact me directly. Thank you very much for listening this video. I am winding up this today's session. Thank you very much.